lauded the launch of Denosa as a turning point in the history of the nursing profession in our country. Those were quite prophetic words. And indeed, the arrival, the formation of Denosa was a turning point in the nursing profession in South Africa. You revolutionized nursing, you repositioned nursing, of course, in the principles and the ethos of the greatest nurse, Florence Nightingale, but you made it much more relevant to the South African conditions and circumstances. Until then, nursing in this country had been largely defined by racial divisions. In our past, President Mandela would surely be pleased to know that Denosa has chosen as its theme for this celebration 20 years of unifying nurses. We celebrate with Denosa that together we've done away with race-based nursing organizations. And today, Denosa is the only authentic voice of nurses in our country. We applaud you for that. And together we have done away with a racially segregated healthcare system that rendered inferior as well as undignified public health services to the majority of our people. Working together, you have transformed an unequal, fragmented public health system into an inclusive and integrated, comprehensive national service. If you did not know what you have done and achieved, this is one of the great achievements that you have made. Working together, we have expanded access to health care, especially to disadvantaged people in our country, the poor, also who live in the rural communities. We have been building a cohesive national health system that prioritizes primary health care. We've built new clinics and new hospitals. Together, we are investing greater resources to expanding efforts to prevent diseases and promote healthy lifestyles. In celebrating your milestone achievement, we must recognize that South African nurses are critical agents in the restoration of the dignity of our people. And I'm pleased to know that Denosa, having been founded, was also founded on really outstanding principles, outstanding values, where you saw patients as people with dignity who needed to be treated with the dignity that is enshrined in the Constitution of our country. Not only do you heal the wounded and care for the sick, not only do you save the lives of babies or the mothers giving birth, not only do you help to repair broken bones and limbs, not only do you treat bent wounds and cure ailments, you work to relieve suffering and rekindle hope. You are the people who are giving our people hope. In many ways, you are also miracle workers. Miracle workers in the sense that you bind broken bones, you heal burnt wounds, and you give our people hope for a life beyond ailments, injury, and suffering. Throughout its 20 years, Denosa has mobilized its members to do a whole number of things, but more importantly, you have mobilized your members to maintain the integrity, to maintain the respectability and the profile of the nursing profession. It has consistently worked against prejudice, stigma, and discrimination. It has promoted the equal rights and dignity of all patients, regardless of their status, be it HIV status, regardless of their sexual orientation, regardless of their race or economic circumstances. You are the people who often know so much more about intimate details of ordinary people, and you have executed and continue to execute your task with great dignity, fortitude, and commitment. And our nation thanks you and salutes you for this. We express our heartfelt gratitude to Denosa for appreciating that without a unified, professional, ethical, dedicated, and caring service to all patients in South Africa will not end the burden of deadly infections like HIV and TB. Behind our country's remarkable progress in the struggle to end AIDS are the thousands of nurses who provide unbelievable service, who provide counseling, who provide care, who provide testing, who provide antiretroviral therapy. Behind the dramatic reduction in mother-to-child HIV transmission that we are recording in our country are the stories of women and men in white uniform who rigorously implement the necessary prevention measures. And those